Good morning, everyone. This is Coach Sam from Ultra XB Wellness and Performance Center. Thank you all for joining me for this presentation. So today we're going to be discussing one of the diseases called the silent killer, the high blood pressure. So why is this disease called silent killer? The main reason high blood pressure is a silent killer is because it is largely a symptomless disease. And often in time, this is developed slowly over time with no obvious symptoms or indication that something is wrong. And the best way to protect yourself as an individual is to be aware of this risk and make changes that matter before this specific silent killer result into some dominoes effects of cardiovascular disease. So now let's talk about the facts about cardiovascular disease as well as high blood pressure. So when we're talking about cardiovascular disease, we're talking about any disease that affects the heart or the blood vessel, which high blood pressure affects the blood vessel as well as the heart. And why is cardiovascular a very crucial topic that should be talked about? It's because cardiovascular disease is the #1 cause of death in the United States. And having hypertension puts you at risk of heart disease, stroke, as well as other cardiovascular disease. And according to CDC statistic in 2021, hypertension was a primary or contributing cause of 691,000 deaths in the United States. So which is why it's often important to understand what is blood pressure? What number is associated with having high blood pressure or hypertension? And what other cardiovascular dominoes effects can occur due to having high blood pressure? These are some of the crucial topics we're going to be emphasizing during this presentation. So now when we talk about blood pressure, we're talking about the pressure of blood pushing against the wall of those arteries. So now when we talk about high blood pressure, we're talking about the heart or the vessel overworking. So that means you have the greater pressure in those arteries, which can lead to other cardiovascular disease or even rupture of those vessels. We are going to come back to this slide again. So now let's look at the main number that is associated with blood pressure. So when we talk about blood pressure, often in time, you will always have two numbers, one for systolic and one for diastolic. So systolic number will always be the top number, which also called the systolic, and the diastolic is called the bottom number. So when we talk about systolic, we're talking about the heart contracting. Think about the heart, just like this picture right here. Think about the left ventricle, which is after the blood enter the left atrium, which is the oxygenated blood coming from the lungs into the left atrium, go down into the left ventricle and being pushed, squeezed into the aorta, down to the rest of the body. Think about the contraction phase as the systolic. And when we talk about the diastolic, think about the relaxation, the filling up of those ventricles. So now when we look at this in the realm of high blood pressure, let's look at this in terms of a garden hose. I'm going to use a faucet, which is very easy to understand that. Think about a garden hose being attached to a faucet. If I turn on the faucet nice and just slowly, just maybe so the faucet is currently at 12 o'clock. I turn it slowly to about 2 o'clock. At that phase, the pressure is low, right? So if I'm trying to stop the water flow, right, and I take the garden hose and I fold it, I can easily stop the water flow. Now think about this. If I turn on the faucet to the maximum pressure, think about how hard it's going to take me for me to, in terms of fold the garden hose in order for me to stop the water flow. And even if I'm able to fold the garden hose, there's still going to be some water that would likely escape due to the greater pressure. So now think about this. Even if I fold the garden hose, now if the pressure is greater than the strength of my garden hose, this can cause a rupture of my garden hose. Now think about this in the realm of artery, which is why it's often important to understand what those numbers really means. And as we discussed earlier, most often there's no symptoms or sign that you have high blood pressure. That's why it's often important to check that regularly. So now, when we're talking about those numbers, what is a good blood pressure? Often in time, when you look at the normal blood pressure, people often tell you less than 120 for systolic and less than 80 for diastolic. Those are good blood pressure. But now when you get into those elevated blood pressure and going down to high blood pressure, you see those number increases for systolic as well as for diastolic number. So the reason why it's often important to understand what those numbers really means is so you can take an active role in your care. Because often in time when you go to your primary physician, the first thing they usually take your vital sign, and blood pressure is part of the vital sign. So now if they tell you like, oh, your blood pressure is this, so and so number, so now you can start understanding what those numbers really mean. And where are you placed in this table? So from there, you start understanding what necessary behavioral changes do you need to make so as to ensure your blood pressure does not go to maybe stage 2 or even a hypertensive crisis mode. So now let's dive into some of the risk factor of high blood pressure. So when we're talking about the risk factor, we're talking about what are those factors that causes high blood pressure. And I'm able to divide this into two categories, which is non-modifiable and modifiable. Think about non-modifiable as some of those actions that you can't change. You don't have power over it. Like your genetic. You don't have any power over it. Whatever your parent passed down to you is what you have. You can't really change it. So now if you have a family history of high blood pressure, what is your likelihood of you having a high blood pressure? The chances is a little bit higher. But what can you do in order to prevent or delay your chances of developing those high blood pressure? We're going to get to that. So now when we're talking about age, how does age increase your chances of developing high blood pressure? I want you to think about two things. Think about compliance. I know a lot of people might not understand what compliance really means, and also the elasticity. Think about a young vessel. A young vessel has a normal elasticity property in order for the vessel to contract and also to dilate so as to maintain the proper form. So now when you're thinking about as you age, in terms of losing those elastic property, so that means your vessel is not able, let me find the camera, your vessel is not able to contract and dilate to the full shape. So I know there is other terms that we use in regards to that. So I just want to, in time of explaining to layman term, because sometimes people refer to as like a increase in preload. So because when your vessel is not able to contract, squeeze, and really relax, so now you have a increased preload. We just increase how much blood is inside before the squeeze, which lead to high blood pressure. But don't worry about that. So now we also talk about gender. So now we discussed that men are more susceptible to having higher blood pressure than women. Talking about people with chronic kidney disease, their chances of developing high blood pressure is also higher, as well as when we're talking about race. African Americans are more likely to develop high blood pressure compared to other race. So now let's turn our attention to modifiable action. When we talk about those modifiable action, these are the action that you have power over, something you can control in order to prevent you from having high blood pressure. Also, you can maintain your blood pressure. So the first thing is lack of physical activity. Being sedentary increase your chance of developing high blood pressure. Unhealthy diet, eating fats, high fat diet, high saturated or trans fats diet, it does increase your chances of developing high blood pressure. And also, high sodium intake does increase your chance of developing high blood pressure. Being overweight or obese also increase your chances of developing high blood pressure. Drinking too much alcohol, sleep apnea, smoking, as well as stress. Ladies and gentlemen, stress does increase your chances of developing high blood pressure as well. Even though there is no study that really, in terms of correlate to the chronic stress as well as the chronic high blood pressure, but there is research that talk about how stress contributes to high blood pressure, which is in relation to in terms of recruitment of our sympathetic nervous system, which does increase the input of catecholamine. So then when you have high level of catecholamine, which does increase heart rate, cardiac output, which in turn increase blood pressure. So now let's go back to our previous slide. So we talk about the modifiable action, which let's focus on the first three: lack of physical activity, unhealthy diet, and being overweight. Those three stuff can also increase your chances of developing what we call atherosclerosis, which is the plaque buildup behind the endothelium, causing a bulginess or a narrow of those arteries. And when you have narrow of those arteries, that increase blood pressure. So now when the atherosclerosis reach to a specific stage, whereby there is a little bit a severe narrow of this artery, that's why people have heart failure or even stroke. And when we talk about stroke is just the inability of the heart to deliver adequate amounts of blood to the brain or to the rest or to the body. So now when people suffering from those severe atherosclerosis, most of the time when they undergo surgery, a cardiologist sometimes go into this area, put stents in there so as to push those plaques so as to allow blood flow. And when there is a stent inside those arteries, which is a foreign object, this individual is often placed on blood thinner medication so as to avoid plaque buildup. But now if the severity of this atherosclerosis, the plaque buildup is a little bit severe for stents to work, that's when they do a bypass, especially when we're talking about the coronary coronary artery, which is the artery that supplies oxygenated blood to the heart itself. So now when you have a blockage or atherosclerosis that is a little bit severe, that's when they have the CABG, coronary artery bypass graft, in those areas, so as to reroute oxygenated blood into the heart, so the heart can receive oxygenated blood. So now this is just going over in terms of how African American are much more susceptible to have a high blood pressure compared to other race. So now let's talk about some of the domino effects of high blood pressure. So now if you have an high blood pressure that is untreated, uncontrolled, or even undetected, these are some of the domino effects that could happen, which include having stroke, vision loss, heart failure, heart attack, kidney failure, and sexual dysfunction. So that's why it's often crucial for you to make sure you're checking your blood pressure and take an active role in taking a proper step for a better lifestyle changes. So now going back to the same risk factor, which we already mentioned. So now how can you go about your blood pressure, or how can you prevent the risk of developing high blood pressure? The main step you need to do is make an healthy lifestyle changes. This is what you need to do. And what is included in healthy lifestyle changes? Number one, stop smoking or avoid secondhand smoking. And when we talk about smoking, people often associate smoking with smoking cigarettes, because I often get this question a lot. Oh, I don't smoke cigarette, but I smoke marijuana. I don't smoke cigarette, but I smoke cigar. I don't smoke cigarette, but I have electronic vape. Just think about it. Smoking is smoking. Your goal is to avoid smoking entirely. The next thing is maintaining healthy weight. This is very important because often in time, people associate weight with just number. I think I'm going to make a presentation in the future about why skinny people are fat. There's a lot of documentary about that. What I want you to start thinking about when we talk about weight, don't think just about the number, think about the content of those numbers. So when I'm talking about the content, think about fat-free mass, think about the lean muscle mass, think about the percent body fat. Those are the main content you should be very much more in tune to understand. Because often in time, you might see someone who is at 6 foot, weigh 170, but according to the data, they are not overweight. But when you start looking about the content of those numbers, that's when you're going to realize, oh, you're overweight because you have a greater percentage of body fat, which greater percentage of body fat does increase your chances of developing cardiovascular disease, which include high blood pressure as well. Eating healthy diet that is low in sodium, saturated fat, as well as trans fat, because this society is all about fast food. And when you look at a lot of fast food, they contain high level of sodium. That's why in our previous resources or previous lecture that we talk about fruit and vegetable, that's why it's often important to eat healthy food that is rich in fruit, vegetable, whole grain, as well as low in fat dairy products. Next thing is limit alcohol intake. This is very, very important for you to limit how much alcohol consumption you are drinking. Because think about it, the kidney can only process a certain amount of alcohol per day. But if you're consuming excess amount of alcohol, then what's going to happen? There's a lot of cardiovascular, even some kidney disease that can be developed as a result of that, and also cancer. That's often in time whenever I'm doing consultation and we're talking about in terms of our weight loss. Because often in time, I want to get in terms of the lifestyle behavior that you are currently doing based on food, alcohol intake, and all other aspects of wellness. Often in time, people will tell me that, oh, I don't really eat that much. But when I start diving into alcohol intake, that's when they're going to start realizing, no, I drink a lot. So now in that area, this individual is not eating their calories, but rather they're drinking their calories. So now they think alcohol and water is the same. No, it's not. Alcohol also contains a high level of calories, which we're going to discuss about during our future lecture. And also being physically active. Those are some of the healthy lifestyle changes you can incorporate into your daily living. And according to American College of Sport Medicine, the minimum recommendation is for you to be physically active for at least 150 minutes of moderate intensity per week. Now, when we talk about physical activity, which I love this topic, which we're going to discuss in our future lecture. When we talk about physical activity and exercise, often in time, people think physical activity and exercise are the same. Ladies and gentlemen, physical activity and exercise, they are not the same. They are totally different thing entirely. Physical activity is not exercise, but exercise is part of being physically active. So in our future lecture, we're going to talk about what makes physical activity different from exercise. We're going to talk about that. Don't worry about it. Just make sure you guys stay tuned, subscribe to the YouTube channel, which is where all this information will be posted, as well as on our social media, which is where other resources will be posted as well. So now let's dive into the summary, since I want this to be a little bit quicker. So now when we're talking about blood pressure, we talk about the force of blood pushing against the wall of those arteries. So now when we talk about what's a good blood pressure number, we're talking about something about 120 over 80 or below 120, below 80. So, and what can you do about your blood pressure? In terms of maintaining or preventing the risk of high blood pressure, we already discussed that in terms of making an healthy lifestyle changes. And now about high blood pressure, how can high blood pressure affect you? We talk about the domino effect. If high blood pressure is left untreated, uncontrolled, or even undetected. So now, how often should you check your blood pressure? To take an active role of your wellness, you can check it as much as you want. That's why there's always a kiosk whereby you can check your blood pressure, either at Sam's Club Pharmacy, you can check it up at CVS, Walgreens, and other pharmacy, even your primary doctor office. And some people, if you already develop high blood pressure and you're currently on medication, your healthcare professional will tell you how often you should be taking your blood pressure. What about medication? Depending on your risk as well as your the level of your blood pressure, you might be prescribed some medication in order to manage your blood pressure so you can keep it in control. So the main thing is that you always need to make sure you are following the direction from your healthcare professional as well as your pharmacy. And also, which is very crucial, be an advocate for your health. We're going to dive into this bigger topic of how can you be an advocate for your health. We're going to save that for a later time. All right, so what I also included in this presentation, so again, going back to the table, that's why I'm hammering this so you can really understand what those numbers really mean. So now going to the presentation. So what I included is a calculator that can show you your risk of developing cardiovascular disease, which is through the American Heart Association. So, and this only works for people within the age range of 40 to 75. So if you are within those age range, just search this link right here. So then if you search this link, then it's going to ask you a couple of questions relating to your age, relating to smoking, relating to family history, and also medication. So as to give you in terms of your risk of developing cardiovascular disease, so you can really be much more aware of the severity or how soon you should start taking those lifestyle changes, which I believe it should be now. So now I also include just a YouTube video about how you can measure your blood pressure at home in terms of how you should be seated, in terms of the height of the chair. So it's going to tell you everything about how you can measure your blood pressure at home. All right, so if you have any question relating to the content of this presentation, you can comment down below. But if you have a specific question relating to your health, about your specific blood pressure, please get in contact with your healthcare professional, and they are going to answer that in much more detail or on time. All right, again, this is Coach Sam. I'm going to see you in the next lecture.